right, we have a really quick medication today. The medication we're going to talk about is Acyclovir. That's how I say it. Some people say Acyclovir. But every time you see that VIR suffix, you need to be thinking antiviral. Okay, these VIRs are all antivirals. Trade name is Zovirax. A lot of times what this is going to be given for are for these complicated, hard to get rid of viral infections, things like genital herpes, herpes zoster, or chickenpox, okay? Viral infections that are very hard to manage and control otherwise, we can give Acyclovir to. So what it does, it actually interferes with the viral DNA synthesis. So what it does, it really kind of just inhibits this virus from propagating, from this DNA synthesizing and progressing anymore. Its therapeutic class is antiviral. Pharmacologic class is purine analog. There are some big side effects with these medications and nursing considerations. One of the biggest ones you're going to want to be aware of as a nurse is that you're really going to want to do a really thorough skin assessment on these patients, because this medication, the Acyclovir, can actually lead to Stevens-Johnson syndrome. Now, if you really want to gross your friends or family out, pick up your phone right now, go to Google and just Google Stevens-Johnson syndrome and show them a really good picture. Because what this is, it's really kind of like the skin sloughing off, and it's very unfortunate for your patients. I haven't seen massive cases of this in the hospital, but I have seen minor cases of Stevens-Johnson syndrome, and so it's really something you're going to want to take care of and watch for just by doing a good skin assessment and catching it before it goes too far. Other things you want to keep in mind is this can actually lead to seizures and renal failure. So I want to get a good renal panel with these patients. And it can cause dizziness, nausea, diarrhea, kind of those things that a lot of medications cause. But it can cause thrombocytopenic purpura, which is another skin issue that we're going to want to watch out for. With this thrombocytopenia occurring, these low platelet levels, okay? So really watching the skin, making sure we're doing a thorough skin assessment, and then obviously watching this infection, watching the chickenpox, watching the herpes zoster, seeing if this is resolving, okay? So that's a really quick medication, Acyclovir antiviral. This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.